Hi, this is Dr. Michael Rothman, and in today's video I want to talk about something called IBS, also known as Irritable Bowel Syndrome. Now, if you've been diagnosed with Irritable Bowel Syndrome, you're probably suffering from symptoms such as diarrhea, constipation, stomach pain, bloating, gas, and you may swing from one end to the other. One moment you're constipated, one moment you may have loose stools. What is IBS? It's actually a name given to a syndrome. It's a name, Irritable Bowel Syndrome. But what actually causes Irritable Bowel Syndrome? Now, if you go to your doctor, they may say, well, it runs in your family. Nobody really knows what causes this. It's related to stress, blah, blah, blah. There's actually real causes of Irritable Bowel Syndrome that can be measured and can be fixed. Let me give you a few examples. One of the most common causes of IBS that I've seen in my practice is something known as autonomic dysfunction. Your autonomic nervous system is always trying to control all the functions in your body. We have two sides of this system. One is called the sympathetic nervous system, also known as the fight or flight response. And the other side of the system is known as the parasympathetic nervous system, also referred to sometimes as the rest and repair response. Now, normally your nervous system will control your digestive processes in a manner that is consistent, in a manner that allows you to digest your food properly. However, if you are overly hitting that sympathetic nervous system, that gas pedal, it'll really cause a problem with your digestion, such that you may be constipated, have heartburn, have trouble digesting your food. On the other hand, if you have excessive parasympathetic nervous system activity, you may have diarrhea. You may notice every time I eat, doc, wow, I eat, and then 15 minutes later I got to run to the bathroom. This is oftentimes a sign that your parasympathetic nervous system is overstimulated. Now, what happens to too many people is that they're going back and forth very severely between the sympathetic and the parasympathetic. And this is what is known as autonomic dysfunction. Now, the second major cause that I see in my practice of irritable bowel syndrome is either an anabolic imbalance or a catabolic imbalance. This is something that is not really talked about much in medicine. But people that tend to be overly anabolic will be very constipated. They'll urinate very frequently. Oftentimes they're depressed, and they may have a lot of other symptoms, including fatigue and sleepiness. The catabolic patient, on the other hand, tends to have opposite symptoms. They tend to have loose stools and diarrhea. They'll have anxiety. They'll have trouble sleeping. And so I'll see people in my office that have a predominance of constipation or a predominance of diarrhea, and oftentimes it's because they're overly anabolic or overly catabolic. The last category of patients that suffer from irritable bowel syndrome are people that have what I would call a dysbiosis, bad bowel flora. You have trillions of organisms growing within your body, and they should be in a symbiotic relationship. But if you have bad bacteria in there, then you're going to have all sorts of gastric distress. Now, if you go to your regular doctor, they may prescribe drugs to treat your constipation, or drugs to treat your diarrhea, or drugs to treat your gas, or drugs to treat your bloating. What you want to do is you want to get to the root cause of your problem. If you came to see me, I would measure your autonomic nervous system balance right in my office using some very simple tests. I would also measure your anabolic catabolic balance, again, right here in my office using some very simple tests. Your diet is vitally important to your health, especially to your bowel health, especially if you're suffering from irritable bowel syndrome. Let me leave you with two takeaways. These are vitally important, and if you're going to come to see me, I'm going to tell you right from day one, you have to stop doing these two things, because if you don't stop, I literally can't help you. This is the starting point, though. You have to avoid eating all sugar. Sugar will hurt you in so many ways, it'll make your head spin. But when you eat sugar, it raises your blood sugar, which will then activate your parasympathetic nervous system. And then your sugar can crash, which will activate your sympathetic nervous system. So you're playing ping pong with your autonomic nervous system when you consume sugar. The other thing about sugar is that it feeds the bad bacteria in your bowel. You have trillions of organisms, and when you feed them sugar, you're creating a terrible mess in there, and you'll never, ever improve if you continue to do this. Secondly is fried foods. Fried foods are so poisonous, you have no idea. And these can make you catabolic, they can make you anabolic, they can cause inflammation. You need to stop eating these things. So just to summarize, if you're suffering from irritable bowel syndrome, number one, stop eating all sugar. Stop it. It's poisonous. Number two, stop eating all fried foods. And number three, call my office to make an appointment because I'm going to figure out what is causing your problem. We're going to get to the root cause, and you're going to find out that you're going to have such relief, not only of your bowel symptoms, but many, many other symptoms as well. Well, I hope this was helpful. Have a great day.